So my name is Yvette Salinas. I'm the manager of the National Outreach Services at the National Center for Farmworker Health. Our mission at NCFH is to improve the health of agriculture workers and their families. The topic for today's training is about communication tips and strategies for building COVID-19 vaccine confidence. We know that this is a very important topic right now for those of us working in farm worker communities, and I know that everyone here today will find value in today's training. So before we begin this program, I'd like to cover a few housekeeping items. This session will be in English with Spanish interpretation. So if you need to listen to the session in Spanish, please click the link that's in the chat. Esta capacitación será en inglés y interpretada en español. Si prefiere escuchar esta presentación en español, encuentre el enlace en el chat y haga clic el enlace para escuchar esta presentación en español. Les daré unos segundos para hacer su selección de idioma. Pueden continuar viendo esta presentación, pero ahora van a poder escuchar esto en el idioma en español. Okay. So as a courtesy, I want to remind everyone to please mute your line to limit noise. This session is being recorded, and we will also provide the video on the conference website for viewing. So please share this with your colleagues that weren't able to join today. We also ask that you put all of your questions in the chat box so that everyone can see them, and then we will address them either during or after the presentation. And we definitely encourage your participation. We will also be inviting you to complete an evaluation at the end of the session. So I will post the evaluation link in the chat as we prepare to wrap up. And I want to thank everyone in advance for your feedback, as it helps us identify training opportunities and priorities, and it provides quality educational opportunities for the future. This session is being reviewed for CEUs, for CMEs, CNEs, CHES, Texas CHWs, and THWs. So submit any questions that you may have to Silvia Gomez, who's also a moderator, at gomez@ncfh.org. Next slide, please. Okay, so our presenter today, Robyn Correll, will address many of the concerns that we've identified around the vaccine in these last couple of months. Robyn is a community health worker instructor and public health professional based in Houston, Texas. For the past 10 years, she's been working in the field of vaccine education, helping healthcare providers, community health workers, and the general public better understand vaccine science and how to combat misinformation about vaccines. Today, she'll be talking about messaging strategies and tips to strengthen vaccine confidence that everyone here can use with your patients and clients in the agriculture worker community. So lastly, the views and the opinions presented in today's program are those of our invited speaker based on professional experience and expertise. So I'm going to kick it over to Robyn now.
Thank you so much. And hello, everyone. I am really excited to be here. I've been giving variations of this presentation for several years now, but I don't know if this topic has ever been more important or ever been needed by so many different people working in communities with patients, just in our everyday lives with our friends and family. So my hope is that by the end of this presentation today, you all will feel more comfortable and more confident explaining and empathizing with the factors that contribute to vaccine decisions, responding to questions or concerns about COVID vaccines, discussing the risks and the benefits of these vaccines, and describing some of the processes that we use to make sure COVID vaccines, and really all vaccines in the US, are as safe and effective as possible. We currently have 3 vaccines available in the US right now to protect us from COVID-19. They all have slightly different pros and cons. But the one thing they all have in common is that they're all really, really effective. They work really, really well at protecting people from getting seriously sick or dying from COVID-19. Like with any medical product, vaccines can have side effects. And the ones we see with the COVID-19 vaccines are largely what you would expect after any vaccine. When I got vaccinated, I had a sore arm and a headache for about a day or two after each of the 2 doses, which is what I usually get after my flu shot every year. And that's pretty common. For nearly everyone who gets side effects from COVID vaccines, and not everybody will, the worst side effect that they'll often experience is what we see here on this slide. Pain, redness, or swelling at the site where they got the shot. Maybe they feel tired or have a headache or have some muscle pain, chills, fever, and sometimes nausea. And while these side effects can be a little disruptive, they generally go away after about a day or two and are actually a really great sign that our bodies are responding to the vaccine. You know, that soreness and swelling in your arm, that's your body cells rushing to the site of the injection to defend itself, right? That fever, that's your body turning up the temperature to try and cook out the invader. Not experiencing any side effects doesn't mean your body didn't respond to the vaccine, right? You shouldn't worry if you don't have any side effects. Some people don't. But those who do feel these effects should feel reassured that it's actually the body doing its thing, building immunity. And it's important to note that for the overwhelming majority of people, these discomforts, while they can be disruptive, are nowhere near as dangerous as COVID-19 can be. And that's really why these vaccines exist, why health experts are encouraging folks to get vaccinated. Because while the vaccines can carry some risks, the risks posed by the virus are much, much greater. You know, we lost 500,000 people in a single year. Others have been left with long-term health issues. And getting vaccinated helps you protect yourself from a virus that has caused so much disruption, so much devastation and heartbreak. And getting vaccinated makes it easier and safer to go back to the things and people that we love and miss. Even so, there are some who are still really struggling with the decision to vaccinate, and that's totally understandable. You know, a lot can affect whether we choose to get vaccinated. We have our own thoughts and feelings about the vaccine or even about the disease, about COVID-19. You know, if you don't think that COVID is that big of a deal or that you're personally not at risk, do you think you might weigh those risks and benefits that we just talked about a little differently? Also, our attitudes and biases can play a role. Maybe we read something online or heard something from a friend that really influenced how we view the risks associated with the vaccine, and that could affect whether we decide to get vaccinated or not. And what about our personal experiences or what our friends or relatives are doing or saying or have gone through? You know, if you've had a reaction to a different vaccine in the past, it's completely understandable to be cautious about getting this one. Or what about if you've had a loved one die from COVID? You know, many of us have. That might make you feel perhaps more eager to get vaccinated because the virus has directly affected your life in a really big way. And we'll talk a lot about trust today, who we trust or not trust, and what they say or do can be a really huge factor in how we feel about vaccines. And one more thing to think about is our values, identity, and worldview. You know, what do we view as our role? Who do we feel responsible for in our community or in our home? How much do we think our actions affect other people? Vaccine confidence is a spectrum. It's not a light switch. It's not something you either have or don't, right? And all of these questions and factors can influence where we are on that spectrum. You know, are we all the way on one end where we're eager to get vaccinated and we're first in line? Or are we on the other end where we flat out just refuse the vaccine, nothing you say will change my mind? Or are we, like a lot of people, is somewhere in the middle, right? Maybe we're not super excited about it, but maybe we don't really have any real reservations against it, or maybe we just have questions or concerns and we just haven't made that decision yet. And our positions on that spectrum can change, you know, over time. Our views can change because All of these things, our thoughts, our attitudes, our experiences, the people around us, all of those things can change, and that can affect our decision to get vaccinated or not. And even from one day to the next, we might feel more or less confident about the vaccines. People are complicated, we're complex. So when we talk about building vaccine confidence, we have to keep these factors in mind. We're all in a different place on the confidence spectrum, and for different reasons, right? And so we need to meet people where they are. Something else that can influence our views on vaccines, unfortunately, is also misinformation. There is so much misleading or flat out untrue things out there about COVID vaccines that are spreading online and throughout our communities. Some of it is accidental, right? Maybe we hear part of a story and we share that without really getting the full picture. But some of it is also intentional. We'll talk about it in a little bit, but there are anti-vaccine activists that have really made this an industry where people make a living off of posting misleading or inaccurate information online by making videos or selling ads or speaking at anti-vaccine rallies. And regardless of where the misinformation comes from, it can be very sticky. Once people start to believe it, it can be very hard to dislodge and convince people that it's not true. And all of that, all of those little pieces of misinformation that we're exposed to, it can start to influence how we think about vaccines and where we land on that confidence spectrum. And there are a lot of reasons that people might believe something that isn't true. They might have seen it over and over again. You know, we know from research in psychology that people are more likely to believe something that they've seen repeated often. Even if they didn't believe it the first time, seeing it over and over and over again, maybe in different forms or from different places, it starts to kind of seep into our brain where we're more likely to think that it's true. Another reason some people might believe inaccurate claims is because it makes them feel strong emotions, things like anger or fear or disgust. And when we feel these really big feelings, it can be harder to think clearly or critically about what we're reading. So if you're on Facebook, for example, imagine we're scrolling Facebook and we see a headline that makes us mad. We get really angry, so we might share it so that other people can get angry with us, right? Look at this. Can you believe it? Be mad with me. But we might not always first stop to check whether we should be mad, whether we should believe it, whether we should share it before we do. And then we move on to the next thing in our feed, whatever the next post or story or video might be. Which brings me to another reason why people can believe misinformation, because sometimes we just don't pause to think about it. Social media in particular is a great breeding ground for misinformation because the news feed moves so quickly. If you're on Facebook or Twitter or Instagram or TikTok or any of the other social media platforms, think about how you scroll your feed. You probably scroll down until you see something that causes a reaction. Maybe you laugh, or maybe you get really curious, or maybe really, really angry or upset. And then you react, you do something, you like, or you share, or you click on it. And then when you're done reacting, you probably move on. You scroll on until you find the next thing that makes you have a reaction. And it's so fast paced that we often don't take the time to really challenge what we're seeing. We kind of passively absorb it, let the emotions we feel take hold, and we don't always stop to fact check. But research in psychology shows that when people are prompted to think critically, to stop and really think about whether something might be true or not, then they're actually less likely to believe misinformation and untrue claims. Another big factor is that it's getting harder and harder to tell what's misinformation and what's true. Because so much of misinformation doesn't look like misinformation anymore, right? It can look, for example, like a question. I've seen this happen a lot on social media where an anti-vaccine activist asks a question that looks innocent, but what they're really trying to do is plant the seed of doubt. The way that they're asking the question, the words that they choose, kind of puts an image in your mind that starts having you believe something that might not be true. Or sometimes misinformation can look like a story. But the way that the story is told can leave people believing something that isn't true. So say, for example, there's a news story about someone who died after getting the COVID vaccine. And there's a huge headline that says, so-and-so died 3 weeks after COVID jab. And if you just read the headline, you might automatically think that the reason the person died was because of the vaccine, right? Because they're right there in the headline, right next to each other. But when you actually click on the story and read the whole thing, you see that the person didn't die because of the vaccine, but a totally unrelated medical condition that they were diagnosed with months ago. Right? But how many people click to read the story? How many people just look at the headline before liking or sharing or reacting or absorbing it without critically thinking about it? And even those who do click, how many are likely to read the whole thing? Right? If all you see is the headline, you can really miss important information that could change what you walk away believing. And perhaps one of the most important reasons people believe misinformation is because it comes from someone they trust, someone we know, or maybe someone we feel like we know, someone who reminds us of ourselves, or maybe even a leader in our community, or a well-known person that our community celebrates. We are far more likely to believe something if someone we trust is saying it, which is really where all of you come in. Who are the people in your life, in your work, in your family who trust you? When you talk, who's listening? And who knows that you care about them? And who cares about you and what you have to share? Those are the people where we can really make the most difference when it comes to building vaccine confidence. One conversation, one person at a time. So going through all that, you can see why there isn't really a one-size-fits-all approach to increasing confidence. I'm really sorry, I'm not going to be able to give you this magic formula that will magically make somebody be 100% on board with getting vaccinated. We just don't have one. And that's because people are different, people are complex, and a lot goes into making vaccine decisions. A lot can influence how we think about vaccines and weigh what we think are the risks and benefits, and how those risks and benefits really relate to us and what we value. But there are some universal strategies, some universal tips that can help when you're talking to people about COVID vaccines. So we'll go through a few of them now. You can adapt your message to the person you're talking to and to the situation. How I respond to my 15-year-old niece will not be the same as how I talk to an 80-year-old neighbor. Even if they have similar concerns, I know that they value different things, or they might respond better if I take slightly different approaches or even use slightly different words, right? How I present information on Facebook for all of my friends and family to see all at once will look different than when I'm having a one-on-one conversation with a friend or with a client in person. There might also be times where you may want to ask someone else to have the conversation because they have more trust with that person, and that's okay, right? Sometimes the messenger is more important than the message itself, because remember, trust is key. So if you're not the best person to share that message, maybe you can find someone who has more trust with that person, more trust with that community, so that the message resonates better with those individuals. And when you adapt your message, try to use a mix of storytelling and statistics. Some people really like to dive deep into the science and they want to know the probability, give them all the numbers, but others just don't relate to that, right? They might relate better to a storytelling approach. And for example, when talking about vaccine side effects, Some might take a lot of comfort in knowing that only about 3 out of every 1 million people who get the Johnson & Johnson vaccine will go on to get a rare kind of blood clot condition with low platelets within a few weeks of getting vaccinated. That's a very rare risk. That's about 3 out of every 1 million people. But other people might see that statistic, 3 in a million, and kind of freak out, right? Because that's a really hard number to visualize. It's a hard thing for some people who aren't numbers minded to really grasp and relate to them and their own risk. So while others might feel more assured by numbers, some might feel better about hearing about personal stories, right? Of other people who got the vaccine and were okay, I know several people who got the vaccine and didn't have any issues, or they only had a sore arm for a day or two. Those kinds of stories might resonate more with some individuals. So you want to do a mix, especially if you're not sure what kind of information will resonate with that group or that person. Also, you might not be able to reassure someone after just one conversation, right? Sometimes you'll need to talk with them several times or give a few different responses to their questions or concerns before they start to change their mind. Or maybe they just aren't ready to make the decision right now, but maybe they will be in a week or a month. Play the long game. Build and nurture your relationship with them. Maintain that trust, which remember is key. And let them know that you care about them so that you can leave that door open to discuss the topic again in the future if you can. And now this isn't an exhaustive list, but there's so much more we could chat about, but there is one more tip I want to share, and I think it's a really important one. Respect that this is a personal decision, right? Our choice to get vaccinated or not can impact other people, but it's an individual choice that we all have to make for ourselves. We can't make this choice for them, right? So this is their choice to make. Some people don't respond well to feeling pressured. Some don't want to feel guilted or shamed into getting vaccinated. And so pushing really might hurt your relationship with them or damage that trust, which is not what we want. We want to protect that relationship because remember, people are complex and minds can change. They might read something today or have conversations that makes them more open to getting vaccinated in the future. And we want to leave that door open again so that we can continue to have this conversation little by little, if need be. So there's no magic pill, as I said, there's no magic formula to boost vaccine confidence, but there are some tools, some frameworks that we can use to combat misinformation and kind of help navigate some of the trickier conversations that we might have with people about COVID vaccines. So we talked a little bit about how sticky misinformation can be. And once someone believes a piece of inaccurate information, it can be really hard to convince them that it's not true. So one approach is prevention, right? Many of us work in public health. Many of us know that prevention, an ounce of prevention is worth a pound of cure, right? So one strategy is to help inoculate people against misinformation. Another word for this is pre-bunking. And the idea is really simple. Just like vaccines help us understand what germs look like and learn how to fight them, inoculation or pre-bunking is when we warn people about misinformation before they might have been exposed to it, before they might believe it, right? We teach them not just what information is true, but also what the different techniques used are to spread false claims and really what they should believe instead. Kind of getting to people before the misinformation takes hold. And this really works best with new pieces of misinformation that people might not have heard yet or that might not be spreading very widely. And it can really help put people on their guard. So when they're scrolling Facebook or social media or talking to people about vaccines, they really pause to think about whether something is true, or it can help them know what signs to look out for, that people might use, strategies people might use to get people to believe misinformation. And that can really help prevent misinformation from taking hold. And the way that we do this, actually how the practical strategy for doing this can look a lot like debunking, right? Which I'll talk about in a second. So debunking is when you tell people that a piece of misinformation isn't true. And here's why, right? And sometimes it's called fact checking, but this particular method that we're going to go through, this tool, is put together by UNICEF and several other great organizations. It's found in the Vaccine Misinformation Management Field Guide. And I'll have a link for that particular guide at the end of the presentation. I recommend it. It's a very, very great resource, especially for those who manage social media accounts or put out communication materials for their organizations. So I'll share that at the end of the presentation. And their recommendation, their tool for how you can combat misinformation, but how you can debunk things, is by starting with a fact. You start strong. You lead with the truth, and the truth should really grab people's attention, right? It needs to be as sticky, as attention grabbing as the misinformation you're trying to debunk, especially if you're posting about it on social media. Because again, you want people who are just scrolling through to stop and read your message. You want to get them curious, right? But even if they don't stop, you want what they do see to be the thing that their eyes, the thing that you want them to walk away knowing is the thing that their eyes sweep across and then kind of passively go into their brain. So that's why we lead strong, we lead with the fact. Then you want to warn them that misinformation is coming and tell them whatever the myth or false claim is that you are about to debunk. Now, really quickly, for years, many people working in vaccine education were really reluctant. They were afraid to try and debunk misinformation because they were worried about something called the backfire effect, which is, again, remember repeating the claim. The more time people see things, the more they're likely to believe it. So vaccine educators and healthcare providers, they were worried that by repeating the myth, even so they could debunk it, it would backfire and people would go on to believe the myth anyway. But more recent research has really challenged this idea. And some research has found that repeating the myth so that you can tell people why it's not true likely doesn't lead to more people believing the myth. The backfire effect might not be as strong when we're talking about debunking misinformation as we previously thought. So we don't want to repeat the misinformation a bunch of times, but we also don't want the backfire effect or the threat of the backfire effect to keep us from really pushing back on these false claims that are taking hold and that people are believing and that are affecting vaccine decisions, right? So after we present the myth very briefly, then we want to talk about why it's not true. This is the meat of the debunking, the meat of the fact check. You want to share why the information is false, but also what tactics are being used to get people to believe it, or what reasons some people might have to push out that false claim. You really want to challenge the idea that that misinformation comes from a trusted source. This is important because it really helps build people's capacity to kind of see these techniques, to see these strategies, maybe in different settings or with different claims, but then they'll still be able to sort out misinformation in the future. And it can help put them on their guard when they see these debunkings, when they see these fact checking. It can send a signal to them that, oh, maybe I should be watching out for more things like this. And then you want to end with the fact again. Repeat the truth, right? The more they see it, the more likely they are to believe it. So you want to repeat it again. And an important part of this step is when you convince someone that a piece of misinformation isn't true, it can leave a gap. And sometimes we believe misinformation because it answers a question we have. And taking away the answer when we thought we had it figured out can be really uncomfortable, right? So we want to fill that gap when we talk about the truth. So if you remember the example I gave about the headline saying that someone died after getting a COVID vaccine, if someone read the headline and walked away believing that the vaccine was the cause of that death, and then you tell them that, no, it wasn't, then they're left to wonder, well, then okay, what was the cause of death then? If it wasn't vaccines, then what? And if you don't replace the answer to their question, then you risk them going back to believing that misinformation, right? That misinformation answered a question for them. And by taking away the answer, it's an uncomfortable feeling, right? We don't like not knowing as people. So when you give them the facts, don't just say why the misinformation is wrong. You want to tell them what is true instead. What should they believe instead? What is the real answer to their question? So you can fill that gap. Okay, let's go through an example of how this approach might be used in practice. So say a post goes viral on social media claiming that the COVID vaccine was rushed and we can't trust it, right? The post has been shared a lot and people in your community are seeing it posted over and over again. It's being posted by several people that they trust and they're starting to believe it. And it can be so pervasive, it can be so widespread that people are starting to base their vaccine decisions on that. They're rejecting the vaccine because of this claim, or at least having serious doubts. So if you're on social media or if you manage communications, you might choose to debunk the claim using this fact, warning, fallacy, fact framework. And here's an example of what you might be able to say. We have more safety data on COVID vaccines than we do for many vitamins sold in the United States. A common myth, remember we're warning them, hey, misinformation is coming, is that new vaccines are totally untested. These claims are often pushed by anti-vaccine activists who want to drive traffic to their website to make money, including some who sell nutritional supplements as an alternative to vaccination. They prey on fear or mistrust to try and drive people away from vaccines and toward whatever it is they're selling. But unlike nutritional supplements, COVID vaccines had to be tested in tens of thousands of people before they could be sold in the US. And the data from those studies had to be reviewed by a panel of independent health experts to make sure the vaccines were safe and effective. Even now, the vaccines are watched closely through multiple monitoring systems to verify that there aren't any serious risks that were too rare to be seen in clinical trials. Few medical products, including vitamins, have as high a bar for safety as vaccines. So remember, we start with the fact and we close with the fact. And hopefully that fact is just as sticky as whatever the misinformation had been. And debunking is really great for proactive, broader messages. You post it because you've been seeing the misinformation be shared or are worried that people believe it. But you're not necessarily talking to one specific person. For one-on-one conversations, I actually really like the case approach. And I was first introduced to this approach by Allison Singer at the Autism Science Foundation. And it incorporates a lot of the key elements that we've talked about during this presentation: empathy, respect, trust, a mix of storytelling and science, adapting the message, right? I've actually worked with many healthcare providers who have been using the case approach for years to talk to patients and parents about vaccines for those who may have questions or concerns. And just like the previous approach, this is a framework. It's a way to help guide a conversation, especially if you're not quite sure where to start. So we start with C, which stands for corroborate or find common ground. You acknowledge their concern, you let them know that you get where they're coming from, you understand why they might have that concern. You don't want to launch into why their concern is wrong. You don't want to start by being defensive or being on the attack or telling them that they were misled. Right? You start by empathizing. You want them to know that you're on their side, because ultimately we are, right? We all want the same thing. We all want people to be happy, healthy, safe. Then you share a little about yourself. The A is for about me. You describe what you've done to educate yourself on this specific concern. Did you attend a training that discussed it? Did you listen in on a CDC briefing? Did you talk to your own doctor about it? Here you want to show them that you aren't just pulling this information you're about to share out of thin air. It came from a trusted source, and you're signaling to them that just like they can trust you, they can trust what you're about to share. Only then, after you've empathized and you've established your trust, do you dive into the science. What does the research say about their very specific concern? And like with all health information, you want to keep it accessible, right? Avoid unfamiliar acronyms or medical terms or jargon. You want to use words that will resonate with them. And this is really key. We want to be transparent. The COVID vaccines are awesome. I was really, really excited to get vaccinated. I'm very excited to vaccinate my kids, but they aren't 100% risk-free, and they don't work 100% of the time, right? So we don't want to exaggerate the benefits or downplay the risks. In order to gain trust, we need to be trustworthy. And that means being very transparent about the research and what it does and doesn't show, so that they know that when you share the science, they're getting the truth, right? And then only after you go through that process of using empathy and trust and transparency, only then do you explain or advise. You give your recommendation based on the science. And if you're not a healthcare provider, if it's not your role to give medical advice, then you can still share what you hope they'll consider doing and why. I think this approach really works best in situations where you're talking with someone one-on-one and they've asked you a question or told you about a very specific concern. And sometimes I'll have to go through it a few different times, depending on how many questions or concerns someone might have. But it really does help give a framework for these conversations, which I know because I've been through many of these conversations, they can get kind of nerve-wracking, right? Vaccines have always been something of an emotionally charged topic, even before COVID. And I feel like the pandemic has added this layer of intensity to some of these conversations. So having this framework, something to help you navigate through that conversation, I think can be really helpful. So let's look at an example of how this approach might play out. Say you're talking with someone about the COVID vaccine and they tell you that they're on the fence about the vaccine because they're worried about long-term side effects. Here's how you might respond using the case approach. Yeah, COVID vaccines are new, so I understand the desire to want to wait and see what happens to others. I read a really great article by a vaccinologist on the Children's Hospital of Philadelphia website, and in it, he said, while researchers are still doing studies to confirm, it's highly unlikely that there will be any long-term or delayed side effects. In the 200 years we've been using vaccines, only a few vaccines have had any delayed or long-term side effects, and all of those were spotted within 8 weeks of the vaccine. What's more, COVID vaccines might be new, but the technologies used to make the vaccines have been studied for years to prevent other diseases. And there haven't been any warning signs that there are long-term side effects with those vaccines either. I was really reassured by that, especially given how much we know about the long-term effects of COVID. I've gotten the vaccine, and I hope you will too. So those are just two possible frameworks you can use depending on the situation, but you don't necessarily need a framework to have these conversations, to have these discussions, so long as you try to have trust, be transparent, and really practice compassion and empathy for the person you're talking to. I want to go through one more example to show you some of these elements in practice. This one is actually modeled after a text conversation I recently had with a loved one. And as a quick side note, one of the ways that I've been starting these conversations is by asking if I can help them get a vaccine appointment. That way, if they've been vaccinated, they can share with me that they've been vaccinated if they're comfortable. And then I can let them know how awesome that is, right? I can send them, heart emojis or celebratory emojis, or I can give them a high five, or if it's been 2 weeks from their last dose, I can give them a hug to celebrate, right? If they want to get vaccinated but haven't yet because they're having barriers to accessing the vaccine, then I can help them overcome those barriers, right? If it's because they don't know how to sign up, I can help walk them through and get them an appointment on the website. If they don't know which vaccine is right for them, I can help guide through that conversation they could have with their doctor. If they don't have a ride to get the shot, then I could help them figure out transportation. If it's a childcare issue, any number of barriers, this question can help prompt so that we can overcome those barriers together and get them the vaccine. And if they've decided not to get vaccinated, then I found that approaching it from this angle can be a good way to invite them to share their concerns, while also letting them know from the beginning, from the outset, that I care about them and I want to help. So I reached out to this person with that simple question: hey, do you need any help getting a COVID vaccine appointment? And here's roughly how that conversation played out. No, thanks. I don't know if I want to get vaccinated. So I responded, yeah? Is something worrying you about it? They replied, did you see that stuff about the blood clots? That's scary. Yeah, the CDC found some cases of blood clots in people who got the Johnson & Johnson vaccine. It was actually kind of amazing. Did you hear about how they were able to find the cases? No, what happened? Researchers tested the vaccine in roughly 40,000 people before it was released, but didn't catch the risk because it's so rare. Once the vaccine started to be used in more people, though, the safety system set up to monitor vaccines flagged it. But get this, roughly 6 million people got the vaccine, 6 million, and it took just 6 cases of the clots for them to pause the vaccine so they could investigate. They responded, really? And I said, yeah. Did you hear why they decided to start using the vaccine again? No, why? Well, after they investigated, they found out that even though the clots were serious, they were also really, really rare. You have a better chance of being struck by lightning than experiencing these clots after the vaccine. That really surprised them. And I said, yeah, but more to the point, when they compared the risk of these clots to the risks of COVID, they realized that way more people would likely be hospitalized or die due to COVID if they stopped using the vaccine. This risk from the vaccine is really serious, but COVID is still more dangerous. After that, they said, that all makes sense, but I'm still not totally comfortable risking it. So I said, I get that, right? I didn't push it. But I did ask. These clots weren't linked to Pfizer's or Moderna's COVID vaccines. Do you think you might feel more comfortable getting one of those? And for time's sake, I won't continue. The conversation did go on a little bit longer, but you get the idea. This conversation could continue in a lot of different ways, right? If the person were to respond yes, that they would feel more comfortable with one of these other vaccines, then you can go back to the initial question. Do they need help finding an appointment? If they responded no, then I could let them know that I'm here for them, and that if they change their mind, or if they have any other questions, right? If there are any questions about those 2 vaccines, I'd be happy to help them find science-based answers. Not pushing, just trying to meet them where they are, respecting their autonomy. At the same time, leaving that door open to continue the conversation, because what we don't want is for them to be making decisions based on inaccurate or untrue, or incomplete information. We want to help them get the information they need to make that decision for themselves or for their families. And so with that, I do want to share some really fantastic resources. I only had about 45 minutes, and so there was so much more that we could cover. So I want to share 2 communication resources that I think are truly fantastic. The first one is put out by NIH, and it's a collection of really great tips and strategies on how to talk about COVID vaccines for different populations. And it uses many, I didn't get to all the tips in that booklet. So if you have an opportunity, I would really encourage you to go and view that document. It's called COVID-19 Vaccination Communication. And unfortunately, I wasn't able to find it in Spanish, but if it is available and you know it's available, please reach out to me. I would love to share it more widely in Spanish too. And then the second communication resource I do want to mention is the Vaccine Misinformation Management Field Guide. This one is available in Spanish. It's, as I mentioned, put out by UNICEF and a few different organizations. It similarly really relies on research. What are the research-aligned strategies to combat misinformation, which in turn can help increase confidence. And then a few more resources I want to mention are specific to the COVID vaccines. So of course, the CDC is a great fountain of information. I want to point out the second link I have there, which is clinical considerations. The CDC has a document, it's for healthcare providers, but anybody can access it, where it really talks about, those questions about, oh, I got 1 dose of AstraZeneca in Mexico, but now I'm in the United States. What do I do? Do I need 1 dose? What do I need 2 doses of? This page can help answer those questions. As a note, the current recommendation is that if you got a vaccine that was authorized in a different country that we don't have here, that you should, if you didn't complete your series in the other country, that you should restart a COVID vaccine series here. So that's 2 doses of Pfizer or Moderna or 1 dose of Johnson & Johnson. But other questions too about allergies and different considerations. If somebody has an allergic reaction to one vaccine, can they get another? That's all written there in the clinical considerations. It's a really great resource. And then the next 2 I want to talk about are the Children's Hospital of Philadelphia and Vaccinate Your Family. They have a really great question and answer site for specifically for the COVID vaccine, but they talk about other vaccines too. And it's really, I think these 2 sites have probably the most detailed answers to a lot of different questions that people might have about these vaccines. And they're written for the general public. They're not written for healthcare providers. Anybody can read them and hopefully understand what the science says. And they're all very science-based. The Children's Hospital of Philadelphia, as far as I know, is only available in English. Vaccinate Your Family, full disclosure, I'm working with them. We're in the process of translating their questions and answers into Spanish in a culturally appropriate way so that those answers are also available in Spanish. And then the last link is vaccines.gov or vacunas.gov. That is a great site for where you can now search for a vaccine provider in your community, for where you can find a COVID vaccine, what pharmacies are carrying which vaccines. If you need a specific vaccine for some reason, then you can search by vaccine using that site. And it is available in Spanish and English. And then another quick resource I want to give a shout out to is Call for Health or Una Voz para la Salud. This is a phone number you can call in English or Spanish to ask a question about COVID vaccines. And then really quickly, I just want to give a shout out to Claudia and Mirthala. Claudia is the creator of these beautiful illustrations that were used throughout the presentation. And Mirthala is the fantastic Spanish interpreter who had to keep up with me throughout this presentation. So a very special thank you to both of them. And with that, I hope we have a few questions now where we can get some questions answered. If you have questions about anything we covered today, or if you have questions about the COVID vaccines, please feel free to throw them up in the chat or in the Q&A, and I will try to answer them.
Hi, Robyn. We did have one question that came in through the Q&A. We had a couple, actually. One is asking, how do you recommend that health center staff address vaccine hesitancy among patients, especially those of vulnerable populations like agricultural workers?
Yeah, so that's where I would really highly recommend the case approach, where you kind of go through that framework of, asking them, well, if they decline the vaccine, if they say they don't want to get it, really asking, well, may I ask why? Is there something that is concerning you that we can talk about? And trying to get to the core of their concern. They might have more than one, so it might take some time. If you have time, if they have time to sit through and get through those questions, then I would highly recommend the case approach as a framework. I've known that too, that some providers, it might seem like a whole process having that conversation, but typically you can get through the case steps and guide through that conversation in just a few minutes, really. And so I would strongly encourage you all to really think about how can you ask the question, how can your staff ask the question about what their concerns are, what their questions are, and then help them find answers to the questions. Or if it's a barrier, if they're having trouble accessing the vaccine, how can you help them overcome those barriers? And it's one person, one conversation at a time. I wish I had a more universal answer, but that's really what research shows works best.
Okay, thank you, Robyn. And the other question has been addressed in the chat box already. Someone was asking if parents were asking about the vaccine for their children and which company is currently producing the vaccine for children.
Yeah, and if it's in the chat, but I'll also say it for those who might need the audio. Right now, the only vaccine that's authorized for kids is Pfizer's COVID vaccine. And that's available for kids 12 and older. They are going through clinical trials for kids who are younger than 12 to make sure that the vaccine is safe in that group and to make sure they have the right dose for that age group. I know Pfizer's going through that. Moderna is also having clinical trials for their vaccine. But those vaccines for kids under 12, it will likely be several months before we start to see that in younger age groups, if not maybe next year.
Okay, and then another one came in asking, what has been one of the biggest challenges in navigating myths and vaccine hesitancy?
It's a hard one to choose just one because there are so many challenges. I think honestly, it's combating myths has been very challenging because often the myths, it's very easy to create a piece of misinformation, especially if it's completely untrue. But there's a saying that myths travel faster than truth, right? And so it's very easy to create misinformation or pose the misleading question or share content that's not true. It's much harder to explain in a very careful, research-aligned way why that information's not true, why it's misinformation. And so it can often feel like by the time we feel like we have a message that works to combat one piece of misinformation, 5 other claims have sprouted, have popped up. We do have one thing in our favor. Some of the pieces of misinformation popping up about the COVID vaccine actually aren't new to vaccines. Some anti-vaccine activists, for example, they use the same claims as they did for maybe the HPV vaccine, which prevents cancer. They've used a lot of the same claims against that vaccine that also weren't true. And they're trying to tie that to the COVID vaccine. Things like infertility, for example, where there's no evidence at all that the HPV vaccine caused infertility. Now we have huge, robust studies that took years to do, but now we have robust information showing that HPV vaccines do not cause infertility. But we also similarly, there's no evidence that COVID vaccines cause infertility either. Just the evidence isn't there. But, taking the time to build a, really great, well-designed scientific study and having multiple studies that confirm the results, I mean, that takes time. And while that's happening, misinformation can spread very quickly. So I would say that's the biggest challenge is, we just need more messengers. We need more science, I guess, to reassure folks. And honestly, it would be really helpful if we had more tools available on social media to help amplify science-based messages, because social media is such a perfect place for misinformation to spread. People can share information very quickly. And even with the little, it takes time to flag things on social media with that little warning sign. Even with those warnings, people can still see it, believe it. And so there's some tools that would be very helpful. But I think that's probably one of the biggest challenges for us is how quickly things can be generated and spread before we can address them.
Okay, thank you, Robyn. And we do have another question asking about resources and if you have any related to addressing COVID vaccine access in Indigenous languages.
I don't know of any off the top of my head, at least comprehensive ones, but that is a fantastic question. And I'm happy to share my email address in the chat. So if you all have questions like that, please email me and I will see what is available out there. And if there is anything, especially if you have a specific Indigenous language that you're looking for, please let me know and I will ask my network to see what might be out there and available in that language. Thank you so much for everybody who came to listen and participate. It's just exciting to see people come and listen to these presentations because, as I mentioned, I really do feel like this is one of the most important topics that we can talk about today, especially working in public health and in medicine. So thank you so much for coming.
Okay. Thank you, Robyn. Appreciate all the great, valuable information that you provided today. And as always, thank everyone who joined us this afternoon as well. And as we mentioned, if you have any questions at all, feel free to reach out to us and we'll try to get answers for you. Thanks again. Have a great afternoon, everyone.